Lisa Marie. I'm at Hurley Medical Center. It's a kickoff to Poison Prevention Week, and I'm here with Dr. Hernan Gomez, who is a specialist in emergency medicine, but poisoning as well. Let's just cut right to it. When there is an incident of poisoning in the home, time is of the essence. Seconds are important. What is the first thing somebody should do?
Well, the first thing someone should do, if it's an ingestion or poisoning unexpected at home, there are two options. If there's any concern at all, we at Hurley Hospital are open and encourage parents to bring their child here for us to evaluate, look into the substance and find out how much harm it could cause to the child.
Now, as a parent, my first thing would be, I got to find out what to do, go on the internet,
Yes.
but really what I should do is pick up the phone, call 1-800-222-1222. That is poison control. What information are they going to want from me?
They're going to be asking about your child's age, the weight. They want to know about the substance. So, for example, if it's something from the laundry room or the garage or at home, have it in your hand when you call the poison center. They will ask for the exact ingredients that are in there, and they will help decide if you need to go to the emergency department or not.
Okay, so let's talk about hazards that are in the home, because as a parent, we may think we have it under control.
Yes.
We may not have it under control. What are some of the things kids are going to get into that we're not even aware of? What things should we be aware of hiding and getting out of the way of children?
Well, I'd say there are at least three big areas to be concerned about. One of them is simply medications. And a typical scenario is going to grandmother's house or to the relative's house, or perhaps they may be older than the young parents and perhaps are taking blood pressure pills and the like, and the child might get into it. For example, grandmother's blood pressure pills, which in a small child can cause some fairly severe symptoms that would leave us concerned.
And let's talk about the garage.
Well,
things like this.
The garage certainly has certain mimics. For example, very common things, for example, the windshield wiper fluid that's blue, you see pretty much in any gas station throughout the city or country. Well, it looks an awful lot like Kool-Aid or various power drinks. It only takes one mouthful of this particular substance to cause some severe poisoning problems. So this is something you definitely want to have secured away.
So we're talking about younger kids. What are some things that parents can do to kind of prevent these things from happening in the home?
What I would recommend is becoming a child or imitating a child. And this sounds a bit unusual or funny, but I would literally recommend getting on the hands and knees and crawling over the house and seeing what may be on the ground, like pills dropped on the ground that the child might take, or see what might be available. And securing medication, securing things in the laundry room, like, for example, a Tide Pod.
We
see
they
Tide
look like
Pod
candy.
look like candy. They explode in child's mouth, cause problems in lungs and in the gastrointestinal tract. All those things should be secured. And if you imitate a child, crawl around the house, you might find these little things and help you put some ideas in terms of how to secure them.
So we always think about poisoning in the home being with smaller children that may not know, but when we get into the teen years, a lot of times it's not an accidental poisoning.
That's
where
correct.
they're ingesting things that they may have gotten from friends, Adderall, things like that they think it's going to help study. What should you look for as a parent?
That's correct. I would look for any kind of a mental status change, and by mental status change, if your adolescent is simply he or she is not quite acting like herself, perhaps even runs a fever, feels warm to touch, has a fast heart rate, I would be concerned about at least a possibility that there may be an ingestion. And go ahead and bring your child to, anytime we're more than open to see either a child or an adolescent in the emergency department. The reality of it is that there is a high level of mental health issues that we see in the emergency department. I would say without exaggeration, around 25% of the adolescents we see here are here for mental health problems.
Wow.
And mental health and maybe suicidal ideation.
Okay.
And with suicidal ideation, they may have ingested some pills for self-harm.
Wow.
So just simply keep your eyes open, be aware of your child's mental health, but always feel free to bring your child to the emergency department for us to evaluate, both psychologically and medically.
Right, that's some great advice. Again, it is Poison Prevention Week. We're at Hurley Hospital. If you think your child has ingested something, call 1-800-222-1222. Dr. Gomez, thank you so much for your time.
You're very welcome.
For Cars 108, I'm Lisa Marie.